welcome back. My name is Sherry. I'm a certified medical laboratory scientist. It's another lovely Friday for pajama and videos. End of the last episode, the girl with foot infection came back visiting ER saying it's getting worse. So I'm guessing in this upcoming episode, we'll have a heavy focus on microbiology findings, which means we will be involved. I'm so excited right now. Let's get started.
In Vanco.
What's Vanco?
They're
really
giving
strong antibiotic to kill
Vanco
skin
because that
germs.
means
Need a
they
hand?
already got
No,
result coming
we got
back
this.
from micro
just
saying she got
Pretend I'm not
gram-positive
even here.
bacteria
Let's
infections.
send off a CBC, blood cultures, and CMP.
I don't remember they
And
sent the
also
samples
lactic
though.
acid, CRP, and calcitonin.
But she's not febrile, not tachycardic, no evidence.
Let me clarify one thing though. The sample I said I don't remember they sent. I'm referring to the samples that you collected from the skin, the actual infection site. The sample that they saying they're gonna send off now, the blood culture, they are peripheral blood, which means they will be drawing from your antecubical area or the inner elbow area. That's very different from a local sample. They will be sending off as tissue or fluid because at this point, if you're drawing blood from here trying to find the blood culture result, that means they are already at the stage of suspecting your infections is going to your bloodstream. Your whole body is in situation, not just your foot area at the superficial.
I am getting concerned. This is a millimeter past the line.
Or my line was sloppy.
Oh, that's
increase in pain?
way too fast.
Sorry. Let's try morphine.
White count's only 10,000. It'd be over 12 for service.
Well, you can't get a result that fast. It's only been like
Still
5 minutes,
febrile.
not even
Do you
5
have past
minutes.
history of MRSA?
Not specifically, but she's never going to
Hold on.
hospital.
Any evidence of an immunocompromised
They
state?
don't
No,
know
she's
if she
on
got
steroids use.
MRSA.
Maximum heart rate's only 89.
Is that okay?
That's good, very good.
But
Stay with her.
he already gave
Monitor her
Vanco,
closely.
isn't he?
If there's any change in her condition, come find me. I mean, any change.
Am I missing something?
And Whitaker, you know the tongue blade exam?
Yeah.
It's a great test for a mandible fracture.
Gus, bite down hard on this for me.
That looks very painful.
Selecting the BP.
Sorry, Gus.
Okay, this redness is now a centimeter over that line, and this might be a bullet forming.
Vanco takes a little time to work.
That's
Vital signs are still
absolutely
stable. 1 in
flashy
22 over
bacteria
78.
series.
I got it.
How are you feeling, Debbie?
I'm feeling a little warm.
That can happen with Vanco.
Those dark blood-filled
Lactic acid
boosters are
4.2.
terrible. Lactic 4.2?
okay.
Oh, that's bad.
What's wrong?
That can be a sign of a more
Jesse,
serious infection, but the
1
good
gram
news is
meropenem, 900 milligrams clindamycin. Page Dr. Garcia, please.
What's going on?
we're adding new antibiotics.
It's serious.
Hold
We
on,
wanna
I'm a
get
little
ahead of it and make sure it
confused
doesn't
now.
become serious.
So she got Caflax at the beginning, that's a broad spectrum, and then they switched to Vanco, that's a gram-positive specific narrow spectrum antibiotics. And now they adding carbapenem and zosyn, which are both broad spectrum, back into her treatment again. So they switching in between a lot. That's very strange. Like to me, it's very strange.
Spiked attempt to 102, gave Tylenol.
She's in fever now.
Check out her leg. That is a definite bulla. Did surgery come down yet? Not yet.
That
I need
is.
surgery.
Page up again. Surgery would be a last resort.
Did they ever
We would
get
like
any
them to come down
result
and
back
check out
from
your leg
micro
in
at
case we need
all?
to remove this infected skin.
I thought it was just a little swelling because I'm on my feet all day.
I'm starting getting a little irritated. 'Cause I really want to know what bacteria she's getting her infections from.
Oh.
Got a hot one here.
Yeah, possible Nac-Fas.
Possible.
Need CT with contrast to
It looks
confirm.
like an
By the
amputation
time
case
you
at
get your
this
CT, it's
point.
going to be up to her waist. She's going to need a hemicorporectomy.
She needs a CT scan.
How about the stainless steel scan?
For Christ's sake, Rabinovich. Robbie, what
Oh.
the fuck are you doing?
You kidding?
Oh, God, I think it might be.
That's called dirty dishwater exudate without purulence. There's a gray appearance to the fascia, and in the OR, you'll see easy separation in the tissue planes.
When do you start your sabbatical?
Tomorrow.
Not a moment too
So
soon.
what's a
for coming
bacteria?
Labs are back. Albumin's low, total protein's low. He also has megaloblastic anemia.
Malnutrition.
Oh,
Probably jail
another
cuisine. Whitaker,
turnaround
what
time
lunch
error.
B12, folate, iron levels.
We're not getting any better.
We're
We
gonna run some
are
more
not.
tests, Mr. Varney. Hang in there.
Okay, I actually need to step away. calm down myself a little bit before I sit back in front of the camera talking to you again, because this episode today, episode 5, is putting me in rage. I'm not doing episode 6 anymore today. This is I have too much things need to say now. For people who doesn't quite know what is gram-positive bacteria and gram-negative bacteria and all that stuff in the Nac-Fas case, let me do some simple explanation so you all know why, as a lab person, I don't like how they present the case in the PITT. Okay, here we go. Imagine you are in a fighting zone. All this following things over here could potentially give you an attack. We have some potatoes over here. They are the regular bacteria who does not have any antibiotic resistant. And they are the gram-positive potatoes over here, staph, strep, all the other stuff. And here we got a gram-negative potato. Over here, we use the example of Vibrio. And normally we will see gram-negative under the microscope present as pink, and gram-positive under the microscope as purple. So they are very different under the microscope. There is very rare situation we would not be able to differentiate these two potatoes in the lab. So that's why I saying if they ever send the sample, they would know what they are trying to deal with. And then what's the difference in between regular bacteria versus the antibiotic resistant bacteria? Here's the difference. When the gram-positive potato turn into an angry biting Chihuahua, when they cannot be taken care by doing a simple punch from the Cathlex. The Cathlex is a broad spectrum antibiotic. That means it's attack both type of the potatoes, everybody here, even including the drug resistant. That's why all these arrows are coming from. It goes everywhere. It generally just give attack everywhere. However, because it's not a very strong antibiotics, it's a older generation one, only the potato brothers gonna be kicked out. But the angry Chihuahua is very hard to be taken care of. And that's where you go to introduce the Vanco over here. The Vanco is a stronger antibiotic, and it is very specifically target the gram-positive drug-resistant bacteria, the angry Chihuahua. And where did that come from? Now we call them as MRSA, but it is actually a simplified, shortened term representing the resistant strength of the staph, the Staph aureus right here. It will turn into MRSA. It's become from potato into a angry Chihuahua, and only Vanco will be trying to take care of it. But now in the show, we were saying it did not work. So there is another possibility coming. Maybe from the beginning, it was a gram-negative, for example, Vibrio. Okay, the Vibrio is not going to be taken care by Vanco. This is only for Chihuahua. It's a Chihuahua medicine. So this Vibrio would not be responding to Vanco. And then a worse scenario is when the carbapenem and rosin, which at the very end of this episode being added back in the treatment, supposedly they should take care of the regular potato over here, but it didn't. Carbapenem and rosin, they are the broad spectrum again. Did I say Vanco was a narrow spectrum? So right here, this Vanco, it is a narrow spectrum. This over here, Cathlex, carbapenem, rosin, they are all broad spectrum. The only difference in between them is this one's weaker, this ones are stronger. And if it didn't take care of that one of the biggest possibility is this Vibrio is a resistant strength, which means it's a goddamn vampire. Okay, this vampire, it has a physical shape, but it does not being taken care of by a regular punch or a stick punch. These two are different. A gram-positive bacteria turn into a Chihuahua, it will still be a physical existence, a vertebrate animal. So it will be hit away by a stick, by a really strong punch. But this thing over here, it's a vampire. It uses dark magic. It does not care if you punch at it. So what happens over here is this thing that representing a physical punch, it will not work on a vampire, a freaking magic player. And the Catholics, not strong enough. These two, in theory, is supposed to work. They are the silver bullet. They're supposed to work on this person. However, lately, we got a emerged amount of cases of drug-resistant, carbapenem-resistant Vibrios. And those ones are coming from here. The regular Vibrio turned into a vampire, a potato turned into a potato vampire. In this episode, why I'm losing my mind from the middle is because if Dr. Landon or Dr. Robbie ever thought about send a local tissue sample or fluid sample, we would be able to tell both of these brilliant doctors which group she was getting her infection from. We may not be able to tell if she getting CRVP, but for if she is getting the gram-positive potatoes or gram-negative potatoes, or even the angry Chihuahua, we would be able to tell them which one she is getting. Why? Because I even went to the actual Pittsburgh hospital's website to figure out if they have a rapid MRSA test, and they do. They are not just do. They have both the nasal swab and the local swab for doing a rapid MRSA test. So if they send a local sample from her original infected area, by doing gram stain, we would know which potato she's getting her attacking from. And by doing the genetic rapid testing, we would know if it's this angry Chihuahua. Okay, now in terms of the turnaround time of that Nac-Fas case, again, there is something wrong with it. When the girl second time visit the hospital, 4 hours later, around 11 o'clock, close to lunchtime, whatever that time is, at the beginning of the show, Dr. Robbie saying they're gonna send off a whole bunch of chemistry tests, including a lactic acid and the CBC. In this point, nothing wrong, but within 5 minutes, they have a result of lactic acid. And they mentioned her white count was around 10,000. However, here is a problem. It's too quick. Less than 5 minutes is not even enough for you to finish the collection and send them to lab. So what's the possible explanation for that? Is they did a test add-on from the 7 o'clock collection. But here brings in another problem. At 7 a.m., if they actually did collect a full rainbow, which would be including the green and the purple that can run lactic acid and CBC on, the green will not be able to be used for lactic acid. Why? Because the standard collection of a rainbow does not include putting the green tube on ice. But lactic acid is a test, can only be run if you collect it and then immediately throw it into a chilled bag. So that cannot be an add-on. If they do, this result is a falsely elevated result. And I do not believe their lab will be agree to run that test with a unacceptable specimen. Okay, that's not going to happen. We're not going to do that. We're very professional. And also, if they actually did an add-on to get the CBC result of less than 10,000 and make a conclusion saying she is not having any sepsis-related symptoms, that will be horribly wrong too, because within 4 hours of difference, somebody's white count can shoot up over the ceiling 4 hours is enough for you to poke over the line from 10,000 to 12,000. That's possible. So they has to do a fresh collection site. That would be the only way to make sense. But if that's what they actually did in that show, 5 minutes is not going to give you any result. You have to at least waiting until the middle of this show to make that happen. All right? Okay, don't put weird expectations on the test turnaround time. I do not like those phone calls from you guys. I do not. This is the day 2. I'm still working on editing the episode 5 reaction, and now something spikes me up again. So at the very end of that show, when they called saying that prisoner is getting megaloblastic anemia, that's not happening. Okay, that's not happening. Why? Because in the lab, as a lab tech on the bench, what we do, we will reading how many cells you have per microliters of the blood samples. We will tell you if your red cells looks fat, skinny, thick, thin, and all that stuff. Does it looks round? Does it looks like a moon or new moon, something like that? All those things we will tell you. However, to draw a conclusion of megaloblastic anemia, those things need to be sent over for pathology review. Only a doctor will be assigned a diagnosis on their paper and sign their name on that paper to become an official report to go back to the floor, and that's not our job. And that turnaround time is usually, I'm not going to be saying it's definitely over 24 hours, but it's not going to be within 1 hour, okay? If you are a provider, don't expect that turnaround time. And if you are a patient, you are more than welcome to chase around your provider, but do not call the lab saying, why after a whole hour passed, I do not know if I have megaloblastic anemia. That's not happening. We're not doing that for you.